Hi, good morning. Welcome to Living Connected. Amal, welcome to Living Connected. Just for a little bit of context, the reason this podcast exists is because I realize that I have some really, really awesome conversations with some smart people, some folks that are doing some really cool stuff in healthcare, and I wanted an opportunity or a place to memorialize them. And you're probably one of the most interesting people I've met in this industry. You've done a lot of things in your previous role and doing some really interesting things now. And so just delighted to have you on the podcast and have this conversation with you. So welcome.
Well, thank you. It's good to reconnect. We had a good time working together at Humana, so appreciate you bringing me on to speak with you
Yeah.
for a little bit.
So for the listeners, I'm fortunate to call Amal a friend and a former colleague at Humana. He is now Chief Clinical Officer at Monogram Health. And Amal, I thought we'd start maybe a little bit with I want the listeners to know about you and your journey. And then I want to get into the heart of kidney disease, because I think that's an important topic that is still a little nebulous and poorly understood.
Yeah.
But as I look at both of our journeys, right, we're similar in the past that we're physicians. We got into the executive side, and we're both very passionate about the business side of healthcare. Is there something, as you think about this journey, like just this weekend, I was at a graduation party, and there's a ophthalmologist who's leaving clinical practice, and she's going into corporate, right? If you were to, and she wanted to know what the experience is like, what are the watch outs, like, what would you say to someone like that? What have you learned on the business side that you think that people who have no experience are going to be like, whoa, I wasn't expecting this. This is different than what I thought. What do they think it is, and what does it turn out to be?
Yeah, it's a good question, and I get this question a fair amount too, from full-time practicing clinicians.
Yeah.
And the first question I ask them, not to answer a question with a question, but is why are you looking to transition and what are you looking to do? I think they hear and see corporate as another kind of path that exists, and they have colleagues that have done that, and it sounds glamorous, or sounds interesting, but they don't understand sometimes what it is they're chasing and why. And so what I actually ask them to do is really think about what got them into their current path, their current career, their current role that they're doing, and is it truly that they're unhappy with clinical medicine, or are they just unhappy with where they're practicing medicine? And then what is it? Where are they in their state of life right now? Like, right? And I ask them. I mean, you have to really be, thoughtful about this in a fair degree of introspection. Like, what are you actually looking to accomplish, and what are you wanting to do? And look at your family that you have, your career goals, hobbies, and really think about what is the problem statement first before we start questioning is this the right solution? Because corporate is not for everybody.
Yeah.
And there's different solutions out there. And so I actually, what I've recommended to them to do, what I did as well, is, I took a week off from when, shifts when I was working full time, but I didn't go on vacation or do anything. I stayed present and I just journaled and really try to think about what is it that's important to me? What am I trying to go towards? Because whatever step you take next, is going to be part of a journey. And so if you're not really clear on what the mission is or where you're headed, you're going to have the similar challenges that you're having now. And like, having gone through corporate medicine, nothing is linear, right? There's kind of ups and downs along the way, but as long as you kind of know where you're heading, the path will take care of itself. And so that's usually the type of conversation I'll have with folks when they ask me that question.
That's a really, to be perfectly honest, most people who ask me about this journey,
Yep.
Usually those physicians are burned out.
Right.
And they're hoping that the corporate life will be easier. And what I tell them is it's still hard. It's just a different type of hard.
Exactly.
I think one of the things that I have family members who've gone on the industry side now too. And one of the things we talk about openly is that what you don't get in oftentimes in corporate roles, and depends on what kind of corporate role you get, but as a physician, right, when you still see patients, right, in the emergency room, and I'm not as, I'm not as structured about it as I used to be, but I still see patients once or twice a month. And there's a difference in the type of feedback, I guess, you get. There's the soul filling, bucket filling, dopamine hit experience that you get from actually taking care of people. And that's not always there on the corporate side. I mean, it's not that it's not there. It's just depending on the type of company that you're in and the type of work that you're doing. I have certain, physician friends who left and they're doing utilization management, for instance, and they're not feeling the same gratification in those types of roles. Um, I don't know. I mean, I feel like I've been lucky because I've been able to find that gratification. What's that been like for you? How have you been able to find that purpose?
Well, that's where, it goes back to understanding the what and the why behind what I'm doing. And so for me personally, you know, the moment of reflection I had was a couple of years into practicing full-time emergency medicine. I was working in the south side of Chicago, so it was very much a walk-in knife and gun club. Um, but what I saw and what I felt was that I wasn't actually helping people, and I didn't feel like I was actually making a difference, because a
Mhm.
lot of the patients I took care of were coming in due to like kind of the fragmentation of healthcare, the broken down systems, unable to have access to care, and so I was doing a lot of general PCP care work from the ER though, without actually being their PCP, and so I just felt
Right.
like literally if I was putting a band-aid on a problem and not really fixing it. And at the same time, thinking about my background in studied business in college, was very much interested in business and tech, and started seeing different, EMR enhancements come out. And, I was asked, like, have you ever talked to anybody clinical before you implement, these changes that have a profound impact on my workflow? And so spoke with my wife, and, it was like, you got to either do something about it or you got to stop complaining. And I was like, you're right. We need to make this change. And the one fundamental focus for me was, and this was around the same time that my oldest was born, was like, I want to do something that I can tell him that, hey, your dad did this, right? And it was meaningful impact, and something that I think really combines what I know to be right clinically with leveraging kind of the business and the tech that's also important to move things and scale things. And so for me, my mission has always been, I need to do something that I think is going to have meaningful impact, something that I'd be proud to use as a health consumer, my parents or family members to use as well. And so that's what's been driving me. And so whenever I take on a certain project or certain role, I kind of look at the goal of what I'm being asked to do, but then I also look at, and this too, just like going through medicine, right? You don't decide to go to medicine. From pre-med to doctor, there's a path, right? And you have to build up what I call is your toolkits, your tools in your tool belt. And so I look at a role as, is this enhancing my tools, or is this, allowing me to scale some sort of capability that I think is going to drive value? And that's what's driven me throughout the last, 10 so years of this mission, maybe longer, yes.
So now, one of the open conversations I have with other physician executives is that when you're seeing patients, right, that there is something about that patient impact that is really fulfilling. And at least for me, there's just something that you get out of that experience that you don't get in the corporate world. That human touch, that feeling of connection. And for physicians who've left clinical practice and have gone into the industry side, what I hear from some of them, and these are folks that tend to go into type roles, realization management type roles, is they're not finding the same gratification, right? And this isn't surprising. Now, I've been very lucky that I've had the opportunity, I think, to choose those roles that give me purpose and get me really excited about waking up every day. But how do you, what's your advice to those positions, and how have you been able to find that purpose and that same type of human experience on the corporate side that you did with the people?
Yeah, I would say, I usually answer that question back with another question to start with the why and the purpose behind your transition or change or whatever it is you're looking for when you move away from full-time clinical practice. And so for me, when I had that introspection moment, this was, 12, 13 years ago, working at a South Side inner city hospital in Chicago, in the emergency room, knife and gun club, walk-in trauma, not a designated trauma center, but we had, probably a gunshot wound every shift or two without trauma backup. But we also had a lot of chronic sick patients coming in for routine care because we had a large primary care clinic across the street, and folks were being sent away from the primary care because they were just too busy,
Right.
or for asymptomatic high blood pressure type stuff, right? And go to the ER, let them fix it. And after a time, I just felt like I wasn't actually making a remarkable difference in the community. I just felt like I was working through a queue and literally putting a bandage on people. And, at the same time, you had different tech enhancements and workflows being rolled into the ER, that made you question whether or not they had, clinical input before they rolled it out. And so wanting to combine and leverage my background in finance in undergrad, also with my interest in tech, and then obviously working as a clinical physician to say, what can I do that's going to have meaningful impact, right? And around that time, we were expecting our oldest son, who's now 12. And, I remember looking in the mirror saying, I want to do something that's meaningful, that I can say to my son that, hey, look, I took a risk. I jumped from a stable career to try and do something that I thought would have more value. Because for me, the safe route would have been to just keep practicing and go into the partnership route or whatever that would be,
Yeah.
and run an ED.
Yeah.
And I also had that opportunity to go run an ED, but then I took a step back and thought, I'm only going to be in like, one community, and I have such an interest on macro level impacts. I have such an interest in taking good clinical protocols and scaling them in a way that's strategic, delivers an ROI. What is missing in healthcare is someone to be able to communicate what we know is right clinically, but also put the business metrics behind there and
Right.
the KPIs and say, here's why you should invest in it. And so I was like, I want to go make this and do this. But then when you start, you're like, well, where do I start now? What's the first thing, right? And so along the way, it's been a lot of ups and downs, a lot of taking jobs for free, like internships, just I want to learn. And the way I've always assessed my roles is there's two big categories, right? Either the job is enhancing my skill set to be a more effective leader or executive in the corporate world, or it's actually mission critical, where it's allowing me to jump on a mission that I think is going to scale some sort of strategic value proposition for patients. And so as long as it checked one of those boxes, I was good with it.
Yeah. So it's interesting you brought up the kids, because I was reading the most recent survey that came out in 24. I forget who did it, but it was about the number of the children of physicians and the percent of them that were going to go into healthcare, or specifically or wanted to go to medical school, had an interest. And then on the counter to that, physicians who pushed their kids or wanted their kids to go into healthcare. And I'll tell you, one of the best, you brought up your kids, but one of the probably the highlights of my life personally was when my son, he was probably 15 at the time, said, "Mom, I'm really proud of you." And I didn't realize, right, at the time, like there's something like your parents say they're proud of you, friends say, but man, when your kids say they're proud of you, it's like, whoa, right? And I don't know that he would have been proud of me if I were coming home from work as a physician saying, "Oh man, I hate this. I hate this job." And it makes me wonder, right? Like you said you wanted to leave this impression on your children, this idea of like dreams of or goals of like inspiration, where you're inspired to do something and you're taking a risk, I think says a lot, right, to your children. And the ability to, like, what you're teaching them is it's okay to actually like take some risks and and find that thing. So I've no doubt that your kids are going to have a very different view of healthcare than I think had you not made the step. Do you ever wonder about that? Like, do you ever wonder the impression your kids would have had on healthcare and their interest in healthcare if you hadn't take this path? Like, I wonder if you'd be a different dad. And a different husband?
Yeah, I probably would. I've never really thought about it, to be honest with you. What would my life be if I did not make the transition jump? It just seemed to me so obvious, um, that I'm going to do it. Like this inner belief, like this is going to happen. But again, I didn't know what the path would look like at all. And when I talk to other um, physicians that are interested in a similar path, and I tell them what I had to do, I'm like, I wouldn't recommend replicating my path.
Yeah.
Um, and if I had to do it again, I don't know if I would have, because it was very, very challenging
Yeah.
to do. A lot of sacrifice to get to where I'm at now. But even then, I'm still a lot more work to do. But what I do know is that it's allowed me as a parent to just tell my kids is, when they talk about what they want to do, is one, support them no matter what they're interested in, but two, tell them, yes, I want you to be happy, but you too, like, you can't just pick something that you're good at because that's what you want to do. You have to really be able to make sure that you're driving yourself, you're challenging yourself, you're working hard, because the feeling of accomplishment is what you're chasing, and it has to be something you're interested in. So you have to marry the two. But what you can't do is run away from something the moment it gets hard, which is
Yeah.
what I see a lot of happening.
Yeah.
Right? Just because it's hard doesn't mean you have to fight through and push through it. So I think there are like those kind of micro habits that you can start training them now, and just as they see now, is like when they try a new sport, new instrument, something at school, issues with friends. I mean, there's so many of these lessons that they can learn. And once they start seeing what it's like to actually accomplish something, I think that drives them to understand that feeling. And you just support them in what they want to do. So,
Yeah. Yeah, it's when I talk about my journey, I say the same thing. Is I don't know that I'd recommend doing it exactly the way I
yeah.
definitely have things that I would have done differently, but at the same time, I don't know that I would be who I am now had I not gone through that journey and made the mistakes that I did. I joke around. I said I got a lot of bruises when I first went in because I went from clinical practice and just jumped right into private equity world. I didn't know
Yeah.
what P&L was. I thought P&L was PNL. I still remember a meeting with the CEO, and I'm like, what the heck is a P&L? What does that stand for? And I'm putting together all these different, so you had the fortune of, having a business background. I really didn't know anything. And I got bruised up very, very, I mean, it was pretty brutal the first, few years into it because you
Yeah.
learn a lot. It's a different way of behaving and it's a different way of communicating, et cetera. Is there, when you think back, and then I want to talk about kidney disease because you're one of the most knowledgeable non-nephrologists that I know in kidney disease. It's quite impressive. Is there anything that because I want to talk about Monogram Health and about chronic kidney care. Is there anything that you think about from your experience at Humana, because that's where you and I met? Is there something you wouldn't know now if you had never had the experience at Humana? Is there something that you're like, man, if I hadn't done that, I wouldn't know this now or be able to do this now?
Oh, a ton. I mean, Humana was great. It was like it was 6, 7 years of really learning about the healthcare industry, how the payer works, learning about their thoughts on value based care, utilization management, trend management, innovation, contracting, working with CMS, working with physicians in the community, hospital systems. I mean, that was the one lens that I did not know before I joined the company. Right, we knew the patient experience, just
Yeah.
and then we knew the provider experience, but the payer, to really work with them and really learn, and then also learn about the other thing that was very good was at Humana just being a very collaborative company. And so learning and working how to work with various different departments on different initiatives and bring kind of that team approach in to solving problems, I thought was great. And then, it's Humana's been a leader in Medicare Advantage. And so just that knowledge, that network that you built, right? I look at a lot of former Humana employees and where they've gone. I mean, it's a great network that Humana has. So I can't be more thankful for the time I had at the company. It was really good.
Yeah, I feel the same way. It was the best. It was really the most learning I've ever had um,
Yeah.
from a high level like healthcare standpoint. It's like you saw the entire. It's like it's analogous to like going into space and watching the Earth turn. I felt like I was, on Earth, and then I got to watch the Earth rotate, and it was like, oh, whoa, okay, now I get it. Now I understand how all these different pieces come together. And I agree. I think I made some really great friends. I
Yeah.
learned a lot. It was a really good experience. Um, so you said value-based care. So that sort of triggered a question, because I see all sorts of definitions of value-based care. Maybe this can then transition in our conversation around kidney disease. How do you define value-based care?
Well, so it's interesting. So value-based care, one, I think the terminology gets used a lot, and so to the point where now, when someone says it, you expect to see some eye rolls, right? Like, okay,
Right.
what does this really mean?
Yeah.
What do you mean by value-based care? And the idea behind it was to really incentivize outcome-driven medicine, right? Really focus on not the kind of fee-for-service type utilization, but more focus on outcomes. So, am I reducing admissions? Am I actually proactively, providing better care for this patient? And then I should be incentivized based on that, right? It's just the way any other industry would work, right? You deliver a good value, good ROI, good P&L, right? You get incentivized, you get a bonus on that. And so, the way I think about value-based care was, this is a way to really incentivize our primary care physicians. Is That's how it started, was in primary care, where they're not having to see 30, 40 patients a day, but those docs that really sit down and spend time with patients and really try to keep them out of the hospital, that they're getting incentivized. Because the easy button is go to the ER.
Yeah.
The easy button is just to pack up your schedule, spend 5 minutes and say, figure it out. If you end up in the hospital, it's okay. The hard thing to do is to really spend time with patients that are complex, their families, and really understand their goals of care, what's important to them, and then put together a health plan that mirrors what their goals are.
Yeah.
That's the hard thing to do. And
Yeah.
so that's what I understood value-based care in primary care. What we see is that, especially in Medicare, our patients are complex though. And so primary care is ill-equipped to do all of this, right? You need the help of specialists. And that, kind of getting into the kidney care, what really, I never thought I'd work at a kidney company, to be honest with you, right? Like that, I'm not a nephrologist. Um, but when I was leading the initiatives at Humana, and looking at, how do we control the space with CKD stages 4, 5, 3B, 4, 5, and then also the ESRD, it became obvious that, the patients with CKD, they're struggling with diabetes, hypertension, CHF, COPD, behavioral health, socioeconomic challenges. There's a lot of multiple comorbidities that patients have with late stage CKD.
Yeah.
And so, so when I think about value-based care, or Humana, Monogram, for Humana, it's, I've got patients with CKD I can attribute to a provider to go provide care for. But a nephrologist on their own is going to not be able to do it. A primary care on their own is not going to do it. You need a multi-specialty provider that can really think holistically about the patient and slow down disease progression. And that's what we're doing at Monogram. And that's what's really exciting to me.
Mhm.
Is trying to build something that doesn't really exist in the marketplace, where you have someone coming in the home backed by a multi-specialty platform, right? So we have a cardiology team, we have an endocrinology team, we have a pulmonary team, behavioral health team, pharmacy team. We've got a group of social workers, all working together behind the scenes with our nurse practitioner and nurse that are in the patient's home, trying to understand what the patient's goals of care are, working with their family, and then putting together a comprehensive care plan and treatment plan that mirrors what the patient family's goals are. And that doesn't exist in healthcare today. And that's what I'm excited about, what
Yeah.
we're doing.
Yeah. Um, I agree. And I became a patient last year for the first time, like a real patient of the healthcare system.
Yeah, you
And
did.
um, there's no cost cutting there, right? Like, these people need a village to care for them,
Yep.
and there are no shortcuts. I think, to your point about eye rolls around value-based care, usually when I hear value-based care and organizations talk about it, what they're really talking about is cost cutting. And what you just said is not about cost cutting, it's about the efficient and effective delivery of healthcare to meet complex needs, right?
Exactly.
You just threw out a bunch of numbers and letters. We were joking about P&L, but there are probably listeners going, ESRD, stage what, 4B. So what should the general public, non-healthcare professionals know about the basics of chronic kidney disease?
Well, it's silent, right? Which is why it's not really well known. But one is, everyone should have at least an annual physical done where you're at least getting blood work done annually. And your comprehensive metabolic panel, which is a general blood work that's done routinely, will have your kidney function on there, right? And so one thing I would ask your doctor is, how is my kidney function? You should know about it. Now, if you have diabetes, high blood pressure, you're at increased risk. And so that's when I'd be asking about it, because oftentimes, because it's silent, because it's not obvious, patients are not always informed that they might even have chronic kidney disease. The simple way to think about chronic kidney disease or kidney function is, it's basically from 0 to 100% functionality, right? So the more function you have, the better. But there's a lot of people that live at 50% functionality. Again, that can be fine as long as you know about it and you're not taking anything to harm yourself, right? So, a lot of our job is more about removing than addition, right? And so
Right.
it's removing like the ibuprofen, the Motrin, the NSAID type medications that can harm your kidneys. It's about looking at contraindication with medications that you're taking. And it's also about knowing where you stand at, because if you don't measure, then it's really hard to improve something. So that's the basic functionality, just awareness is ask, do I have it? Do I not? Because a lot of this is preventable. We can control this. We just need to increase awareness.
Yeah.
Um,
Awesome. All right.
right.
So, Amal, I'm going to wrap up with just a question, a personal question. So the reason why we called this series Living Connected is because one of the things, especially coming out of COVID and then going through a cancer journey, is it became really from a personal aha moment is the thing that mattered to me most in my life. Like the true thing that matters most to me is the resources, time, freedom, and ability to surround myself with the people I love and to have connection with my fellow man. So we call it living connected. And I'm curious, as you think professionally and personally, is there a connection that has been especially meaningful to you through your entire
Uh,
life journey? Who would that be?
just like outside of family,
It
or
doesn't matter.
I mean, definitely my wife. Yeah,
You're a smart man, Amal. It's
100%.
funny. You're a really smart man. I've asked that to a bunch of people, and they all say their wives. So you're good. You're good. Keep going. I've never met her, but I know she sounds amazing.
Yeah, no, she's been great. I mean, it's just when you're making the transition, knowing it's not going to be easy, knowing there's going to be lots of ups and downs, like her being there, just knowing, kind of again focusing on. I know you're trying to do something that you're going to be good at, but also something that's really meaningful. So we just need to work through it. And even leaving Chicago, move to Louisville, Kentucky, right? I mean, she grew up in New York, and
Wow.
so she's from New York.
He
I'm from
really does love
Chicago.
you.
Yeah, and so she used to joke when we met that Chicago's a small city. And then, when this job with Humana came up, that was back when you had to relocate.
Yeah.
And I was like, oh, the job looks great, but it's in Louisville. She's like, doesn't matter where it is. This is like they took your background and wrote a job description. You have to take this. And if you don't like it, we can always move again, but let's go do it and try it. And that was
Yeah.
in 2015.
Yeah.
So it's been amazing
Yeah.
to have that.
One of my favorite quotes from, I think it's Warren Buffett, it said the most important decision you make in your life and your career is who you choose as your life partner. I think
Yeah.
he said your spouse, but yeah, makes a big difference. Well, thank you, Amal, for being on and telling us a little about your journey and just how you're thinking about healthcare in the future and educating us a little bit on kidney disease. So
Yeah, it's good to see you
great.
again.